For centuries, medicine has overlooked the complexities of women's bodies. Their symptoms often have been downplayed or dismissed as just hormonal or in your head, what makes them less likely to be properly diagnosed or treated in time. Welcome to the Women's Health Uncovered podcast. In this episode, actress Barbara Sarafian and gynecologist Milie Nwoye will join me to explore the different seasons of women's bodies. From menopause, breast cancer to mental health, we will explore how the body changes, how these changes are felt, how they often are misunderstood or rarely spoken about. We unravel misconceptions and we will look into what it actually means to be deeply connected to your body and how to be your own health advocate. It's time to uncover the path to better women's health together. I would like to introduce my first guest, actress Barbara Sarafian, Belgian actress with Armenian roots. She grew up surrounded by art, literature, and music. You can describe her as someone who feels deeply connected to nature, seeks the human in humanity, is fueled by meaningful connections, and loves the poetry of life. Welcome, Barbara.
Thank you.
I have a quick question for you. What's one word that describes your connection with your body today?
Acquainted.
Why that word?
Because when things go wrong, we see our body as a strange object. It's not even when things go wrong. When we gain some pounds, it's not us. When things go good, we're proud of ourselves. We are our body. So with acquainted, for me, is like, we're never stranger of our own bodies, and our body is not a separate object of our mind. So when things go less, we're still our body.
Yeah,
and that's for me the most efficient, not fastest, but the most love you can put in getting to know yourself.
Okay, that's beautifully put. We will dive deeper into that a bit later. First, I want to introduce my second guest as well. Dr. Milie Nwoye is a gynecologist, obstetrician, and fertility expert. She focuses on hormonal medicine and is deeply passionate about bridging the gap between medicine and what women actually feel and experience in their everyday life. Welcome, Milie.
Well, thank you. Very happy to be here.
A quick question for you as well. What's one word that captures how it feels as your body changes over time?
Oh, wow. Fear.
Fear?
Yeah, fear.
Why is that?
Well, because there is power in youth. And that's what the society actually appreciates. And so once you start to see the effects of aging, either with your hair thinning or the wrinkles, so physical changes, it makes you wonder what the acceptance of you actually would look like with the new body, which is obviously directly not in line with Barbara's very positive point of view.
Well, I think it will be a very interesting conversation to hear different point of views here today. What I would like to open the conversation with is, Barbara, you've spoken openly about the breast cancer diagnosis and the treatment as well. But what you told me is that you actually liked the fact that there was quite some attention around the story of how your diagnosis came to happen rather than the diagnosis itself, because there is a special character that plays a role in your story, right?
Yes, my dog.
How did that unfold?
Mike is my dog. He's a chocolate labby. And they're known for being very social and to be the glue at their human. And that's what my dog does. And he was looking at me last year just like a sphinx. Like he had his paws crossed and he was like stone, frozen. And that was very strange to me, this new attitude, this new pose. And he did it a few days and then I didn't pay attention anymore. But then again, because when I'm in the kitchen, he's in his couch.
A royal
he's
treatment.
like looking at me, and he wasn't following me with his head. I was doing some tests, and I was trying with a little sausage to, labbies, they eat all the time. And there he was a bit reluctant, and I said, that's not normal. And I was talking about it to friends or somebody who came home, and then the students also, like, he's acting strange. And then by accident or not, I don't think it's an accident, I was scrolling on YouTube and I just had the message, if your dog crosses its paws, you might have cancer.
And that was your sign there too.
And the same day I made an appointment for a mammography.
Yeah. And then you went to the doctor and you got because it was also quite early. You were pretty lucky that the dog played a role in there, because often symptoms go, you don't really know how they are expressed, so they go overlooked. But in your case, because of this story.
Well, it depends on what your relationship is with your pet. If you think you're just the boss and the dog needs to do what you order him to do, then you have a relationship, but not what we have. I'm always staring in his eyes when I have time. We're talking with one another. But it was very early stage.
Yes.
So I cannot throw it away. I cannot throw the drama of the diagnosis away. I cannot say, the story of my dog Mike is much more interesting. I still am recovering, and I need to take it seriously. But it helped me to not panic.
Yeah.
And to see my body as a very intelligent me.
Yeah.
In dialogue with another living species.
Yeah.
It was more my body giving signals and my dog's body responding to them due to our qualities than just like trying to rationalize everything and go into the classical, well-known panic and life fear and scare, etc. So I had a little tear because my doctor was a bit clumsy in expressing the K word, like he said. I'm like, what K word? And he was dramatizing a little bit, and he says, what does it do with you? And I'm like, you're just annoying me. You are annoying me, and I'm just going to solve this because I am lucky.
Because in this case, before diving into it, the story about how it was diagnosed, or the story of your dog, do you know how it biologically is explained? The fact that dogs are involved in, because it's really interesting. They have 300 million more smell receptors than we do in their nose. We have like 6 million or so, if I'm not mistaken. So they can actually detect the so-called volatile organic compounds, or to put it in simpler words, the odors that cancer cells exert through our body, whether it's your blood, sweat, tears, etc., and they can actually detect that. It's fascinating how that can translate into, using more clinical research and solutions as well.
Well, there's a whole discussion because I've been reading myself into it, and I needed to conclude that dogs are still seen as unpredictable creatures. So now the focus and all the fundings and all the money goes to AI.
Yes.
To reconstruct and imitate the dog's...
The electric noses.
Receptors.
The e-noses.
Yes.
Yeah.
So that's a pity. That's a shame, because the relationship between man and animal, we need that relationship just to stay healthy. Actually.
Yeah? The thing is, I read into that as well, but it becomes, if you have a dog at home or a pet and you have a connection with them, that's of course one thing. But to be able to use it at a large scale, I think that's where the technological part comes in, to be able to scale it.
Why?
We don't want to scale it?
I mean, there's so much need into going back to nature. That's what we hear all the time. Go back to nature. Yes. But what is nature? We are nature. But you are made out of cells, and cells are nature, a specimen, a species, are organic species. So there's a lot of space. There's a huge amount of space to bring all the dogs together and to give people a job and to train people into reading dogs and helping people. But
the difficulty
both can exist.
Yes,
Both can exist.
yes. The difficulty is just that it probably takes a long time, a lot of resources to do that, and people are more like, what's viable to do, and less the connection with nature and that side of the story.
Right. And the other thing I think is smartphones came in. And what that meant is we've lost touch with the more nuanced reaction. So I suspect that relying on the dog pheromones theory for diagnosis is a bit tricky. We're less in touch than we were many years ago. We're more distracted, less focused, and we have less concentration. And I think what that does to us is we miss those signals. I think the average woman may not have picked up on the fact that your dog crossed its paws, because we're busy doing everything else but just sitting still and observing.
I am busy with my phone, and then my dog comes up to me and he's like doing this with his paw, and I'm like, oh, you're right. You're right. Why? Because I'm not going to get a dog just to be a dog owner or master, but just because I need joy in my life, much more than just calling a friend, you know. I have he's a king, you know. He's not spoiled. He doesn't want to be spoiled, but it has changed my life. To have Mike in my life. I even have him tattooed.
Oh, wow. Yeah.
I'm a single woman, menopause, and I have a dog. I mean, I feel in the portrait. I do.
But you maintain that connection. You pay attention to it. I think that's a difference, because you say, I am busy with my phone, but the other side of the story is true as well. You are also present.
It's also because of my phone that I could...
there you go. So the best of both worlds.
Yeah, absolutely.
The diagnosis was early. That's true. And you, one of the lucky few, let's say, because as early as it detected, the 5-year survival rate is like 99%. So people who have a later diagnosis have only 31% 5-year survival rate. But what did that do with you? Because it's still a tough information to get. Did that change your view on... No?
Well, I sense that I am getting more and more vulnerable.
Yeah.
The luxury of waking up, jumping out of bed, and just not even look in the mirror, put on a T-shirt without bra, and just in my jeans and do my stuff, that's over. That is the luxury for me, just that freedom. That's over. And I am vulnerable because my mom had cystis. She didn't have cancer. Her sis had. And you know what? It's my lifestyle also. I had a lot of stress, unnecessary stress. But then you have the cortisol doing the hormone that is making you fat too. I was like, okay, I'm fucked. Sorry, it's my turn.
Yeah.
But I can be very unromantic what concerns the cure. I'm practical. You know what? You just have to get this out, and then we'll see. I have a very good professor, the gynecologist, this Herman de Pieper. You know him?
I do know him.
And he knows my body, and he's like, "Oh no, we're not gonna start with chemical things, and we're not gonna start synthetical gels, etc." But he took care of me, and I was like, "I trust you."
What was your treatment like then?
Well, what I wanted, just cut it out.
Yeah.
This is very concrete.
Right.
Yeah.
I saw all the pictures. I took my brother with me, and we looked at the pictures, and I said, it's like the Milky Way. I was not even joking about it.
But it's very speculated as well,
it is.
and white.
And then I saw where the problem zone was, and it was just a single thing, and it was like, okay, do we need to take it out? Yeah, we do. And is there panic? No. And then I stick to that. I'm not going to call everybody up and say, I got cancer, because it's a very early stage. And I have friends who have a more serious case of breast cancer, and I cannot be their sister at the same level So I thought, let's go low key and respect what others have to go through. You just cure this. But I am now extremely tired because of the
Radiation.
radiation.
But can I?
Sure.
Yeah, I think you have remarkable strength. I have made that phone call, called women up with a bad diagnosis. And it's difficult to react the way you did, even though that's the better way to do it. I think it's the easier, more natural thing to do is really to kind of, freak out in a sense. But the fact that you found the strength to choose the harder, which is really the more useful pathway because it gives you clarity, it gives you motivation to follow the treatment guidelines. I think that's more difficult. And I think it's really lots of strength to you, or lots of courage that you have.
Well, I think that simplicity delivers strength.
Right.
If I would just react like I was supposed to react because society teaches us to panic, to have death thoughts, to have the scare, to have... Then I would have done that. But I didn't know. I've been through so much, and this is not being the cowboy or tougher than I am, but we can cure this in a week. And then we'll see how tired I am. The radiation, that's another story.
I can imagine.
How important is body literacy, Milie? Because Barbara's story is important to hear. It's important to know your body as well. It's important to know your body. But how important is body literacy and also prevention, early detection in this case?
Well, good question, Mariam. I really believe that a woman is better able to take care of herself if she understands, one, what she needs to do. Those are prevention screening guidelines. You had the wonderful opportunity of having a prompt to go get a mammogram. But not every woman has a dog and listen to the cues as well. So we have guidelines for that. I think it's also very important to understand once you have a diagnosis, what that means, because it helps you be able to follow through and to be compliant with whatever guidelines or treatment you're given. And I've come across women that they don't want to know the push with the diagnosis. If they feel something in the breast, it's a time to stop checking and run away.
So they don't come to you early enough.
Absolutely. You have women that actually, so you had a microscopic lesion. So that means that you probably had very little or no symptoms. That's very important to understand. So if you have very early breast cancer lesion, it's microscopic. So you don't have any symptoms. So I find it very remarkable that your dog, Matt, or what's his name?
Yeah,
Mike.
Mike.
I could have gone for another test
Check.
Right.
So I intuitively knew it's my breast.
Right. But then there are women that actually feel an actual palpable lesion and they know it's not good, but their reaction is to run because they're not ready to confront. I see this very often.
Is that a conditioned reaction, or does it come from not wanting to know? The fear word that you used in the beginning?
It is fear, absolutely. You know this is not good, but you're not ready to tackle what it all involves, the C word, as you said, or all the, it's a diagnosis, it's the stigma, maybe a little bit. It's everything that has to change about your world. You're not ready for that yet.
Yes.
And so what they do is they pretend it was never there.
You don't want to change your life.
Right. Right.
You have kids, you have a job,
Right.
and
Right.
everything is like a doom scenario. It's like, I cannot stop the way I live now because everybody's depending on me.
Right.
like, also.
Yeah.
Right.
Did it change yours?
I kept on working,
Yeah.
but I am not crazy. I'm not tougher than I'm supposed to, but I said it on TV because I had a program where I have 6 students in the house, and I called the broadcast and I said, I'm gonna tell them. Like, you really?
Wow.
You cannot hide it. So I said to the kids, I got breast cancer. Not for the sensationalizing of the thing, because they were very, very clever. And it's like, but life goes on. And that's what happened. So the press was chasing after me because some journalist must have heard it, I don't know how. And he was calling me week after week after week.
Crazy.
And I was like, you will not write something about it. I need to tell my guys first, and then you'll get the scoop.
Yeah.
But with one condition is that you put the whole focus on my dog.
And it worked.
And it worked.
And it worked.
Well done.
Well, when it comes to the prevention and understanding it, how do we make sure that they know it? Because you also advocate this kind of questionnaire that it's about your lifestyle more.
Yes. So the questionnaire, I call it a Well Woman Wellness Questionnaire.
Okay.
And it's designed because often what I see is women go years with certain symptoms that have been misdiagnosed. And as a result, they get the wrong treatment. So what I wondered is, just like we get in the mail a reminder for pap smear, don't we all get a reminder mail for pap smear? Why don't we make a 20-question questionnaire for women as from age 35? They could fill this in every year. It's designed to do two things. One is it tells them which life phase they're in, reproductive, if they're in the perimenopausal phase or the postmenopausal phase, and based on the phase, what lifestyle recommendations are recommended.
And stress is not
and
good,
what
Barbara.
Screening. Exactly.
Yeah, but stress is also the menopause. That is what happens.
Right. So it so happens that, very good point, it so happens that when a woman is in the midlife, so perimenopause, postmenopause, and onwards, we tend to be less resilient to stress. It's been proven. So that's part of what comes into play with the hormonal changes that result in the symptoms that we get. So the questionnaire is designed to do two things. One is to stratify a woman based on her life stage, so reproductive, perimenopause, postmenopause, and then give them, based on that, lifestyle intervention and cancer and chronic disease screening that they require. On the other hand, it would pick up women who have symptoms that are bothersome. So there are 4 categories of perimenopausal symptoms. If they have any of these 4, they get a tip. You have this, go see this person. Because what I found is also there's so much confusion. Who do I go see? Do I see the family doctor for this? Do I see the menopause counselor for this? Do I see a gynecologist for this? So it comes along with a life phase screening prevention. And if there is pathology present, what to do next. That's what I propose.
What are the risk factors for breast cancer when it comes to your lifestyle?
Oh, so the biggest thing, and it doesn't mean that you get breast cancer because you did something wrong, of course. It's, you know, it's things that increase your baseline risk for breast cancer. So those would be smoking, for example. Alcohol is a big one. Very relaxing, but it increases our risk for breast cancer for sure. We mentioned stress, but it's really hard to stratify. We also know that women who have never been pregnant or breastfed also have a slightly higher risk of breast cancer. And again, this is not saying that, you know,
everybody
will get that. It just means that we all have a baseline risk, and the presence of one of these factors increases them. We haven't even gotten into genetics as well. So there are certain mutations that predispose you to getting breast cancer. But by far and away, the majority of women with breast cancers do not have a mutation, actually. So it's important to know. So we all should be careful and mindful of screening for breast cancer.
Yeah, well, then you have other theories where you hear that the screening is just the harmful.
I hear that as well.
Factor. Like you're not going to put a weight of 3,000 pounds on your breast because then you're going to make everything explodes inside.
Right.
But okay, I'm not a doctor, so I don't know. But it was like, yeah, okay.
Well, plus it's not fun. A mammogram is not the funnest experience ever. It's very personal. It's very intimate. It's a cold plate that squish your breast, like you say. And there are women that are concerned about the small amount of radiation in the mammogram X-ray machine. obviously, I don't agree with that point of view.
I can guess.
I think that it's better to screen and screen often and regularly, because early detection is extremely important to improve your chances of survival.
Rate, yeah.
And just like, yours was also caught quite early. So I think that's important.
You said, on how Barbara approached the news as, strength, a strong person, you need that too.
I don't know.
You don't agree with that?
I don't know what strength is.
How would you define strength?
I would know, because that is changing too in life. Not my values, not my the way I look at the world, and the way I. Brené Brown is very good at that. She says that when you're 50, 55, you're still wearing that harness that is way too heavy for your new body, actually. It's all too heavy, so drop it and go take advantage of these changes to live lighter. And that is, you should imagine, you should think that to live light, you need to fight. That is true, because you have to liberate yourself from a lot of factors outside of you, but also towards yourself. So I have a dialogue with myself that says, try to be earnest and honest when you really believe that something doesn't matter anymore. Don't play that. Don't play it. Live the conviction that something that was old is now not hurting you anymore. And do that with everything you have been surrounding you with people who are just not there anymore, with the choices you make. Am I still, with my changing body, in the old convictions? Because you cannot keep on wearing a very heavy load while menopause or my condition, the cancer, are pushing me to live differently. Here,
yes.
What am I? You cannot live with both options. You have to change. But strength is for me simplicity.
Yes.
I do drama for my job. At home, we don't do that. We don't do that. We just don't.
No acting in real life.
When I'm sad, I'm like, okay, I'm going to tell somebody. And then we do for today. No.
Are you an emotional or rational person in that case?
I don't know. I don't know. I'm both. I'm both.
Yeah?
You cannot separate both. Yeah, I'm both. I have the vortex and I have all.
Yeah.
This how we are wired is not differently than yours. What have I been cultivating because of the way I live and what draws my attention? That is cultivating the muscles, etc. in your mind. But what makes me very emotional is being tired. And then I know it's because you're tired. It's not because the traumas from 30 years ago are still there to haunt me.
But maybe because you've processed them.
I process everything.
Because you've given them a place already. That's why.
Always. Even if it's premature. I'm like, I got a little bed for you, trauma. And I'm going to keep you there because I need to go. And I'll be back.
Yeah.
And if I'm forgetting the trauma, somebody else will point at it and say, you didn't do your job here.
It will come across in the way you act, in the way decisions that you will make. It will somehow find its way to the surface and make it visible if you don't give it a place.
I think that is what happens to each one of us.
Yeah. Yeah.
Look everything in the eyes and say, okay, well, let's walk through hell together.
Yeah.
I never escape. I never flee from things.
You need also the tools for that, because I feel when you say we're both emotional and rational, or you're both, because you experience some things, you have to allow yourself to feel it as well. But then the decisions you make or how you see things, a rational way of processing it, of giving it a place, that's how I would do it as well. You kind of need both, but you need the tools for that.
You are the tool. What we have inside, the amygdala, the vortex,
but we don't know how to
gifts.
Use it.
No, because we have been in the misunderstanding that we have to divide the ratio from the body. People are sometimes saying, I'm not emotional. You are built up of everything is emotion. Refusing to go in a conversation is an emotion. It's a decision based on reluctancy. And this is all emotional material. Saying no to somebody and think you can do it in a nice, cold way, it's emotional.
Yes.
Yeah, don't start to get emotional. No. The one who says that is more emotional.
Already there.
So that's my job. Emotions, like you have, your emotions for me, that is, I'm calculating them. I fold them like I fold my socks when I do the laundry. I do that with my emotions. Okay, I fold them and I put them in a drawer, and then I see them back and I want them clean. And if somebody's trying to trigger me, then I think about my health.
Yeah.
You're not gonna get that anymore.
Be healthy. Think about yourself. And you also wrote about emotions in Begeerte, Desire.
Yeah.
Where did that inspiration come from?
Well, this is a hostile world that we live in. That is, we have to be aware. We have to be aware of the things that trigger us. We have to be aware that we do not trigger many. I trigger all the time. I trigger people. I don't think like that. But I'm there to back you up. I will be the mattress at the same. I will be the puncher, but I will be the mattress too. I do that with people that I love. But there's too much eagerness, there's too much selfishness. It's always working with the elbows, and then we're all surprised that we're in wars. Everything is a mini war. That's what I say in the store when people are just like being rude. I'm like, this is mini Iraq. You know? I'm not that I'm a Karen, but I like, but it's better now. If I would be too responsive to that all the time, my body would say, you're too old for that. You're too tired for that. I'm so happy I'm tired. I'm actually very happy I'm tired.
But then you're writing that, and I think in any case, when you write a book, right, you reflect, you think about things, it makes you rethink what you, in your own philosophies. Was that the case when you were writing this one as well?
I don't have to rethink. I just have to put things in a different perspective. No, proportions. Just like also thoughts can be fact. Ideas, convictions, they can also be sick and used. So you have to reduce the fat and put them bare. And if they have value, convictions or whatever, the convictions are things that are screwed narrowly. No, let it loose. That's what I've always done. And that has brought me a lot of misery because sometimes the only one in the room, but it's okay. But I don't rewrite things. I just came up with some anecdotes because that's what the editor wants, and be concrete. Give him some anecdote, instead of just philosophing all the time. But I only had 20,000 words to write about the
to
desire.
Put thoughts in 20,000
and it was not enough.
words.
It was not. I was frustrated. I was like, I should have mentioned this too. But
I asked you how you take care of your mental health, and if you do some meditation or some of that sort, and you said, I am meditative in life.
Yeah.
What do you mean by that?
Well, something can stress me, like finding the parking spot in the street. It's it. I'm like, close my eyes, go to my third eye immediately. Trust that the building was there before you, and that it is there. And you just go in the building. And don't start panicking because the traffic is disturbing you. So I do that with everything. Traffic is also a thing. It's conversations. So it's just like what happens between people. I very easily go to the third eye. Always like, or even with my eyes open.
Quick reflection moment and
it's simplifying.
Simplifying.
No, all the things that are not necessary. Well, fear and stress do that. They build up, and you don't have a clear sight of what is actually needed from you or for you. Sometimes nothing is needed. It's just being there.
Taking care of your mental health. I feel like okay, there is a source and the root of something, and there are so many layers built upon that. What you do is like, let's take away all those layers. Let's simplify. Let's take all the layers that were built by, as you said, stress or fear, and go back to what's actually going on right now.
Yeah, sometimes you are already too far gone. Just you have to sit down and say, what? What? EMDR is very good for that. When I'm not capable of doing it alone with all my layers, okay, well, I go to a person who does that with me for 25 years now. And it's only a week later that you feel like, it doesn't bother me. But I still want to be at this position of people around me. I want to be the best friend they have. Just to be a listening ear and just like, okay, come over.
I think you're a very good active listener.
I've been talking a lot now.
Mental health, is that something that you also implement in your practice?
Well, mental health symptoms res it's ugly head, so to speak, in several ways in a woman's life. It begins all the way from pubertal changes, where we as women are susceptible to having our first episode of depression, actually, because there's lots of hormonal changes during the adolescence, right over to in the reproductive phase during a menstrual cycle. It turns out that the second half, every month of a menstrual cycle, we actually are predisposed to having mental health symptoms, actually. 1 in 3 women will have premenstrual syndrome. That's what it's called officially. And some of the symptoms are depressive thoughts, mood swings. There are also other physical symptoms too. And then in the perimenopause, obviously, the mental cognitive is one of the 4 buckets of symptoms that you could have. So yes, it's an important part of what I do as a gynecologist. And when I do have the time, I discuss with my patients ways to, because I think you can't do so much about the stress that comes from outside to inside. That's beyond your control. What you can control, I believe, is your stress resilience. Yeah. So there's certain things that we know that are evidence-based that increases our tolerance to stress. So those things that we know are mindfulness meditation. I think you have a lot of history with experience with doing that. We know that exercise does that as well. We know that certain kinds of eating, not necessarily, the diet word per se, but avoiding low glycemic index foods, so eating less processed foods, those things are evidence-based to increase one's resilience to stress coming outside from inside. And we know that stress affects the reproductive cycle and the system for sure. Yeah.
I'm actually curious if you start implementing that within your own practice, because before you did also a transition, right? You were working in a hospital, then for some circumstances that I'm also interested to hear, you decided, you know what, I want to make that shift.
Right.
Can you share a little bit more about that transition? Because then I want to understand, was that also different how you approach your patients? Is that different when you were in a hospital than now in your own practice?
Absolutely, Mariam, absolutely. The reason why I changed my practice was, so no one ever teaches us as women that, so I read the book, from Sheryl Sandberg, the CEO of Yahoo, and it empowered me so much. I thought I would be a different kind of woman. I would work full time, I'll have kids, I'll do it all because, she said you can. I really believe that. But no one ever tells you somewhere along the line, you have to make some very hard decisions. So I came to a point, I had a girl, I had a boy, 3 years apart. And when he turned about 1 year, 2 years old, I realized that I had a good nanny at home to take care of the kids, so that wasn't a problem. But I realized that it wasn't working. I could sense from my kids that they needed to have me more around. I had to make some changes. It was very difficult. I had to hire a coach to convince me it was okay to pull back, because he felt like a failure. You've studied for so long, you should be able to do it. Look around you, why can't you do it? So I had to hire a coach who helped me understand that for my situation, it was important that I pull back. And doing that is maybe one of my best life decisions, honestly, because I have spent more time with my children. Before then, I did not know the entrance to the kids' school. I did not know how to go to kids' school because I had a nanny take care of all that for me. So that was one of my best life decisions. But also the translation is when I see young women, I tell them it's okay to recognize that it's to pull back, to work less, to work differently. Because I think for women more than men, I really believe that we more need to adjust our working styles.
Absolutely.
Than I think men do. And I felt like I had to, and I'm happy I did. So when it comes to my clinical practice, I can let my younger women patients know that, but also it gives me more time with patients as well. And it's more enjoyable. The 5 minutes treadmill consultation is not satisfying.
Do you pay attention to actually also educating them? Because of course, if you go to the doctor and they have to explain something new to you, they take the first 2 minutes to explain something new to you, what's going on. But that's not enough. That's not what I'm talking about. Do you actually take the time because you say, well, now I have more time with them to go much deeper into what's going on and have a conversation with them? Do you take also that role on you?
Absolutely. You have to first, so women come in with all kinds of falsehoods or misconceptions. So the first few minutes is trying to peel that back. They also come in with the treatment plan. Women, we like to solve, we problem solve, we like to solve problems. So we come with a treatment plan. And I always say, no, let's first discuss how you feel. What's bothering you? What are the problems? Make me feel what you feel. And then we can together talk about what that means, so what your diagnosis is, and what treatment options you have.
Together.
And that takes time. So yes, we do, there's time to listen and to deliver treatment advice, but you need time to correct the misconceptions that we're all full of.
What are one of those misconceptions that people come to you with?
There are too many of them. One of them is the belief that menopause is something wrong. You're making too little hormones, and that's not good. But that's what we're supposed to do. That's physiologic. The pathology is in the symptoms, actually. So we're not trying to correct any hormonal imbalance with menopause. We're trying to take away symptoms. That's one thing. Another I see very often is the fear of missing out. So a woman comes in, she has no symptoms, and she says, well, my friend takes this. Should I also? Am I missing out on some particular benefit? No, it's not a vitamin supplement, that we administer. It's a treatment designed to remove symptoms and improve quality of life. I could go on with lots of examples.
I believe
really.
there is a lot because there is so much to be educated about, to understand your body. But then we go, as you say, my friend is taking that, or I read this on Google, that might be fine. Or now TikTok shows that aspirin is good for pregnancy, so people dive into that. So there is a lot of information that we just absorb and we try to find our way around it. In your practice, you focus on hormonal medicine, you said. What falls under that umbrella?
So it begins with the premenstrual syndrome or symptoms, which is a lighter form of it, all the way to PMDD, so premenstrual dysphoric disorder. That's like PMS on steroids. So that's one aspect.
I guess I was there.
It's 1 in 20 women that have that. So it's not very common, but it's out there. I also focus on the perimenopausal transition. So women having those 4 bucket symptoms I discussed, the vasomotor symptoms, or the hot flashes, the night sweats, difficulty sleeping. That's one. The second is the cognitive. I think that's one of the most important ones for a woman, in her 40s, full-time work, is being able to keep up cognitively, so the brain fog. We also kind of handle other symptoms like the physical symptoms, so the muscle stiffness on awake in the morning, the constant joint pain, shoulders, knees, hands, and then certainly the sexual symptoms, which luckily is now coming more into awareness. But yes.
You're describing different symptoms, and I see Barbara agreeing on some. How did you experience, because you've also openly spoken about menopause and how it affected you, your body, your connection with it. How did you experience that transition?
I was in shock. I literally said to myself, is it this time already? Really? And I remember what happened, and it was just the outside of my body. It's like fitting in your clothes. I was in Rome with my son 6 years ago, and I was trying to put on a pair of pants, and I'm like, what? Because in the mirror, I didn't see any difference. It's not that I keep on standing in a mirror for an hour. I'm like, what is this? And I was like uncomfortable. And it's from that moment on, and that summer also, my body was changing. And then came the brain fog. Yeah. And not yet the hot flushes, etc., but the brain fog. And it's my surroundings that said, you said that already. Okay. No, you said that. Okay. The driving went very difficult. I purchased a bigger car just to be sure of myself, because once I was behind the wheel, I was like, what are you doing next to me?
Were you prepared for
No.
Do you feel like you had enough information? You knew enough about it? Were you prepared for facing this phase?
What I knew was like, is it that time already? Shall I go for the embarrassment? Or should I go for the solutions that I can only find out if I listen carefully and keep my body me and not as a strange object that I'm like starting to hate because it's betraying me? Because that's a very, very, very dangerous one.
Yeah, because your
body is
view
betraying me.
on your own body changes. You, as you said the first time, you don't fit in something. For you, you have to also learn to love your new body or the new you.
That's a lot to know. It's not, you don't have to love yourself all the time. I'm very, very weary of all that self-love thing. etc. When it's too fast to love yourself, you have to go through that crusade. And then you decide how you love yourself, not by pampering yourself and showing that to everybody. That's not self-love is just like having some tough conversations. Like, are you nagging again? When I see my muffin top, I'm like, yeah, but stop nagging about it. Stop pushing it away. It is your skin. And I'm like, I don't like it. Okay, let's agree on that. Do something about it. Yeah, but how? Ooh, millions of ways. By listening to you. Oh, maybe that's a good idea. I'm just trying to reap some solutions here.
What are some of the solutions you implemented?
Well, I did something, and people don't like to hear that, but it worked wonders, miracles for me. I did the carnivore diet.
Okay.
Oh.
I don't want to drink collagen from a bottle that is so overmarketed. It's poisonous. Or I went to the butcher behind my door. Just no supermarket, no processed food, a real butter, cheese, eggs, meat, fat fish, no oil, no plants. For 4 or 5 months, I didn't have aches and pain anymore.
You felt a difference?
I lost 5 kilograms. I didn't have brain fog. Nothing hurt. My hair was growing back. I had a very clear vision. I slept better. But then I thought, it's dangerous. But to me, it wasn't dangerous. My skin changed, everything. And I quit because it's a very tough diet.
But solutions for menopause, do they all work for everyone, or should we, depending on your body as well?
Yeah, so that's why you need to talk to an expert, because it's different for everybody and there is no one size fits all. What I try to do is, like I said, explain where let the woman understand where her symptoms come from, and then I offer them treatment options. Everything begins with lifestyle changes, and then it's layered up with either medical, hormonal, or medical non-hormonal. I must add, though, Barbara, it is true that increasing your protein intake is important as we approach midlife. Probably not to the level that you did that, but it is true that we need to eat more protein to mitigate the weight gain that comes along with aging.
Yeah. it is till the end of my days, at least, that I'm gonna try to find out what makes me feel good.
But that's the whole journey about knowing what works for you.
Well, we lost the luxury at a certain point in our lives, like saying, I can eat whatever I want, I can do whatever, while knowing that when you were eating those fries that you knew that you were harming a little bit. But there's also pleasure, because that's also hormones, etc. So, but the luxury of that balancing is also gone. Like, I'm going to have dinner tonight, and I know that if I'm in a negative mood, I could call it, I'm going to pay for it. Well, let at least start to enjoy it. There are certain plants that I cannot eat anymore. The nightshades are very dangerous for me because they give me headaches. I see it on my skin. The tomatoes, potatoes, etc. While I like them, but fat, a lot of fat.
Well, it depends on what works for you. What you also said was that the menopause made you find harmony. Are you looking for more harmonious relationships, or when it's about people looking at the calmer side, the peaceful side of things, or how would you describe that?
Well, I had a reunion today, job for job. We had a meeting, and I said, I just want to have fun. And not only because I want to have fun, but it's so much nicer when there's space for fun, but when the basis is structurally, the work is well overthought and is structured, and then you have a good dialogue, and you say, let's stick to the plan. You have to be tough to say that, because they're like, oh, why is she bossy? No, well, let me just be bossy for the beginning, and then we'll have fun. But let's always go back to the blueprint of what we agreed. I've always wanted harmony, but I was in stages of my life, even in the PMS zone, too aggressive to go and get it. I have a very fiery nature, that is so. And the fact that my flame is a little smaller doesn't mean that the engine is broken, etc. But it's what helps for me, for my job also. It's not pulling attention to me. And the balance is always being extremely attentive to what happens around you and being fascinated and not being bored or cynical because you know life. No, rediscover at my age, like, I've always seen it like that, but now I see it this way. And this is that's a new story. It's not a new story, but it's another way to talk to yourself and just be softer. I love it to be soft, but everybody's surprised around me. That's true.
Because of the presence you bring to the room?
I don't know, but because I'm convinced that you should listen to me. I'm a boss, you know?
Like that.
There is nothing wrong with that.
We're three bosses, and it's a good thing. It's not being aggressive, but in an ugly matter. But like, hey.
Yeah. I have something to say too, and it matters too. Is it that where it comes from?
No, it is. I know what I'm doing.
Yeah.
And it is not something that I have to push or. And I've been impatient always, like, let me. And now it's like, but I've had that for years now. But now I really enjoy it, like leaning back and say, yeah, I'll pick my battles if I have to.
Yeah.
And you go home and there's no battle, there's nothing.
Picking your battles for your peace of mind and mental health as well. But that kind of highlights what I wanted to mention about how important it is to know your body, because we're talking about menopause, but at the same time, it's one of those symptoms that has been misdiagnosed a lot as well. When it comes to menopause, it's been misdiagnosed for whether it's depression, whether it's fatigue, the mood swings have been also diagnosed for being something else. There was actually a funny story that I was reading. Well, funny story, it's not that funny for the person itself, but just to highlight about the fact that there's so little attention paid to those symptoms. Where do they come from? You say, well, I sit down and I listen to them first, make me feel what you feel. It's not always like that. You don't really get to do that, because there was Halle Berry. I don't know if you know the actress, the well-known actress. She went to the doctor with also symptoms that she said, my private area was swollen. I went to the doctor and they were trying to figure out what it was. Well, they did some tests and they said, you have herpes. She says, okay, we go home and then we are trying to figure out at home who brought it to the relationship, where did it come from. Days it's about discovering like how it happened, etc. Days pass by and the doctor calls to say, you know what, you don't have herpes. And she says, what? What then? And the doctor goes, I don't know.
Oh, jeez.
And she says, okay, that was for me a signal to go and search for myself. Okay, what am I feeling? What does it come from? And then doing her own research. And she says, I came across the dry vagina syndrome. So symptoms that happen when you are in your perimenopause. And she says, everything checked the box. So then I went to the doctor to say, you know, what if it's this? Let's look into it. And I think that comes from, first of all, understanding yourself as well, because it's that literacy, you know, your own body literacy, that's important as well, to sit down, listen, and also know what's going on. What am I feeling? Where does it come from? So you can go and be like, you know, these are the things that I'm feeling.
Yeah, but we've always been impressed by the terminology, but because then you prove that you've been studying. Like doctors do that with us, impress us. And I remember that 15 years ago, I had aches, belly aches, stomach aches, actually. And I said, I think I got an ulcer. And he was like, oh. Yeah, I got an ulcer. Oh. So we already were in some kind of disaccord. He was like already, before we did anything, teaching me that he was supposed to know my body better than I myself. Yeah. So, and I said, okay, let's bet. We have to, like whatever, I don't know, a cup of coffee, etc. And I'm sorry, but I was right. I had 13 ulcers.
Wow.
And he said it were my intestines, and I said, why? Yeah, right. And that's what I have a family like that. Not like don't listen to doctors because you have to listen to doctors, but trust your guts.
Yeah, well, absolutely. I think the idea of knowing your own body is also knowing that medicine doesn't solve everything. Nothing does, actually. And so knowing your own body means when you get a diagnosis that doesn't quite fit what you think, push back, you know. Mm-hmm. I must say, at the same time, there are many. So for one Halle Berry story like that, there are other 99s of people coming in with the wrong diagnosis too. So it's a conversation, I think. Mm-hmm. There has to be trust, for example. And the trust stems from, I may not get it right immediately, but give us time. I think with time, we're generally able to figure out what the diagnosis is. But medicine is not 100%. You know, I don't think that anybody says that. It's one attempt to get you to feel better. Mm-hmm.
But it's also true that, you know, we have had, when it comes to the women's body, because that's what we want to focus on, there has been little research, little inclusion in research, little inclusion in clinical trials. So even doctors don't know yet enough when it comes to certain conditions to be able to diagnose it correctly.
Absolutely. I'll take you back to 2002. I was in Chicago. I was I think a second year medical student. It was the day the WHI study was published. Mm-hmm. So what was the year? I'm sorry. So what happened then was we had to stop all women taking hormone therapy abruptly because the message from that study was hormones are bad, they're dangerous and unsafe. Mm-hmm. So we stopped all women taking hormone therapy and we had no other alternatives for them. What I'm trying to say is this, is that yes, there is not enough research on women's issues. Part of the reason is that we're very complex creatures, right? With men produce testosterone from puberty. It stays stable till around 30, 35, and there's a very gentle, slow decline. Compare that to the hormone profile for a woman. It's very complex. Yeah. So research has to be not only gender-based, but also time in the life phase, but also in the menstruation cycle phase. Are you on the pill? Are you not on the pill? So it's more complex. Obviously, it's still very important. Yeah. But the point is that it is more difficult to use women as research subjects. It is needed, but it's more difficult.
Yeah. We are called complex creatures, and I don't use that word. I say sophisticated.
Okay, I love that.
It's a man who told me that.
Right.
He said, "You're not complex, you're sophisticated." And I was like, I love you.
I love it.
I love you. Because that is mental strength.
Right.
If you get that little present, and one day you're not even waiting for a compliment or for something positive, and you just get that, oh, I can live on that.
Absolutely.
And it's a man saying, out of my love for women, I just tell you that at this very moment. And I'm like, okay. Because mentally it does a lot.
It does.
It's beautiful, eh?
Yeah, absolutely.
I like it as well. You're sophisticated.
Yeah.
Because we don't also look enough, or how do you see that? We don't really approach women's health holistically. We're now discussing, the vagina, it's separate. Last time we had a researcher on the podcast also saying, she is, Sarah Ahanach last time, studying the female microbiome that hasn't been studied for so long. And we look at your different organs holistically. And even when I studied biomedical sciences, you're looking at the heart, you're looking at your intestinal tract, you're looking at this and that. But you don't look at it holistically. And that's also where it is, I think, the misdiagnoses come from, because you assign it separately.
Well, it's a 21st century problem, because what's happened is medicine has gotten more complex or sophisticated.
Well, medicine we call complex.
They're objects, yeah.
So what that means is that a gynecologist now has to know, I think, more than she did 20 years ago. So it's not possible to keep track of all the different research in all the different systems. So you need that divergence. But this is where I think the family doctor, your house doctor, plays a big role, actually. And that is putting everything back together. You see a cardiologist for your heart, you see the endocrinologist for your thyroid, the gynecologist for your uterus. You have the family doctor who puts it all together. Because in 2025, it's not possible. I don't have any clue about heart disease anymore. I can't. I'm way deep down into hormone gynecology, and I think that's good. But that's where the house doctors should play a big role for women.
Well, we've discussed all the different changes a body goes through, and I think that's what we also wanted to highlight. We briefly touched upon how that makes you see yourself, or how do you experience the shift through your eyes? And I want to get back to that as well. How you experience that shift, or how do you see that change happening, the connection with your own body over the years?
I'm an actress, and I've never watched myself, never. Not even the Russians, like, what do I look like? I have a double chin. I'm not a jawline actress, like. So okay, let's go. What are my plus points? What are my qualities? It's not the symmetrical face I have. I have my body. Let's use that. That's what I always say to colleagues. Your physics are gonna define your playing, your acting, and use that. That's what I do. But I'm getting older, and I've always before that been considered as a woman who had no sorrows. They still have the tendency, people around me in my job, like, you have this, you have that, you're successful, you have this, you're thin, you're this, you're that. And I'm like, oh, so I'm not supposed to have whatever issues in my life. Okay. That is changing now, and people are relieved around me. Then, now you do it. And I'm like, okay, that's also a way to harmony. But when I look at men on the set looking at me, I'm like, really, I need to get used to that. They're like, it's not. They don't have to be bewildered, and I don't need to see the lust in their eyes. But I'm like, I need to go further now in simplifying what I used to find normal for myself. So I need to change, but not adapt from outside. My newness in how I am perceived.
Yeah.
And I think it's extremely interesting, and not because it's me, but because it's just I am an instrument. And okay, you don't have the luxury anymore. You had, okay, but this is the old violin that has been played a lot, and I think it's very interesting. And looking at myself is, I don't have mirrors in my home, because why would I? I don't do that. But only when I say to myself, oh, I don't care what they think of me, I'm like, stop, that's not true. Are you honest? Or is it really, are you sure about that? And sometimes I'm sure. I'm like, well, I don't feel it cares. Sometimes I'm more vulnerable, and that these are the moments that I'm like saying to myself, stay honest. I can go for this if I want. Next week I can do this. I can go and cut myself. I did that before. I can do it. But
it won't change how you feel about yourself.
No, I'll do it next year. But
What's one thing about your own body that you had to unlearn as well, Milie?
Well, I think, and that's what's not often spoken about when it comes to midlife, and that is that there is a lot of self-knowledge that comes with aging. What that means is you know where your strengths are and where your weaknesses are. And I think that's actually where your self-confidence comes from, because no one is good at everything. But knowing the things that you're very good at, so where your strengths are, that's when you actually get self-confidence. So I find that as I get older and I look less, young as I did before, I find myself actually being more self-confident.
Yes.
Because I know what I can do well, I know what I cannot do well, and I don't waste any time in the latter group.
yeah, that's the unlearning. You don't waste that time putting everything in question, etc. I think we should have a society where women at their 60, 55, 60 are just at the top of everything.
Yeah.
And we should be used as consultants, as absolutely, because I know that now I'm much better at expressing my needs or what I have to offer. I have experience, you have experience, and it's just at the apex. It's just in a nutshell. Okay, we can offer it. It's lighter than before. We don't have the ego is softer.
There is a lot of knowledge that's put into certain perspective that could be shared and should be shared as well. We've heard a lot of interesting things coming from both of you today. If there is one word to wrap it up at a full circle, I know that you would want, or that you take away from this conversation, that you would others want to remember, what would that be and why?
Don't look at me first.
Milie, go ahead.
I'll timidly go for it. No, acceptance, actually. I think that's where it all starts from. Accepting yourself where you are at. It doesn't mean you have to stay where you are at, but it's a first step to improving yourself. Yeah. So that's what I'm working on myself now, is just accepting the person I've become.
Acceptance.
Yes.
I think that's a nice one for everything that we've heard that's been shared. What would that be for you, Barbara?
I would think acceptance.
Original.
No. Unlearning. You just mentioned unlearning,
Yes.
and that is comes after the acceptance. Like, what can I get rid of?
Yeah.
You are, balance. No, it's already a second word.
Yeah. Unlearning is something that I implement as well when I start everywhere when I go, whether it's something that I have to, it's a new workshop, a new talk, or new something, when it requires changing people's mindsets or trying to bring something new, I start with the unlearning first. Because you can't really build up something that has already a certain belief. It's like unlearning to learn something new, and acceptance comes in there as well. Thank you very much, Barbara, Milie, for sharing all your experiences, knowledge, thoughts. I hope you enjoyed it as much as I did.
Well, it's so interesting. I could go on for hours with you.
Yeah, it was really fun. And I guess my word should have been sophisticated, I must say. That's going to be my new word.
I didn't want to recuperate it. Sophisticated. Yeah, well, it's all.
Thank you very much, both of you. And also thank you to our listeners. I hope that they learned a lot, and they will still do in the episodes to come.